Welcome to Ship with Our Registered Nursing, where I support new grads from passing your Nclex to coaching new or novice nurses to become gritty so you'll persevere and lead in the field. Let's shine. So, today we are going over the urinary function assessment of the kidney. I am going to go through some questions and answers along with the rationale. So, this will help you whether you're doing med-surg or for your NCLEX. All right. Just bear in mind it's an overview. This is going to let you definitely understand the urinary function and how to take care of your patients. Okay, let's go. So, the first slide, the question states patient admitted to the hospital for progressive renal decline for the past 6 months. The care team assigned to patient is considering the use of dialysis. Which situation would indicate the use of renal therapy? So, A, patient's creatinine level drops below 1.5, and B, patient blood urea, which we also blood urea nitrogen, which we also shown for BUN or BUN, is above 15, and C, 50% of nephrons are not functioning, and D, 80% of kidney functioning is lost. Now, I know we would definitely need to know a little background to answer this question. And by the time we end today, you will definitely know how to answer it if you don't. Okay. I'll give you a chance to probably try to get it. The answer is D. 80% of the kidney functioning is lost. And I'll tell you why. So nephrons are the functioning unit of the kidney. And when 80% of the patient kidney is not functioning anymore, this means that the patient is now in stage 5 of a chronic kidney disease. And they definitely would need the dialysis because the kidney can no longer excrete the waste from the body anymore. We call it ESRD, which means end stage renal disease. So at this point, kidney failure is fatal, and the patient would need either a kidney transplant or dialysis therapy. So we call it ESKD. So end stage kidney disease. Some people say renal too, but that's the right name. Okay, let's go to the next slide. So on this slide, here you're seeing the all 5 stages of chronic kidney disease. So stage 1 with normal or I, GFR, and the GFR is the glomerular filtrate rate. That's how well the kidneys filter in the blood. Okay. So the first stage is greater than 90 milliliters per minute. Stage 2, mild chronic kidney disease. The GFR is 60 to 80 ml per minute. And then stage 3 is broken into two different sections, A and B. So stage 3A is moderate chronic kidney disease, and the GFR is 45 to 59 ml per minute. Stage 3, moderate CKD, the GFR is 30 to 44 ml per minute, and you have stage 4, 15 to 30 minute, right? And stage 5 is less than 15. Now, at stage 5, you know your patient definitely needs either they're gonna consider the kidney transplant or the dialysis. It is definitely time to take these interventions. So, associated symptoms may include uncontrolled blood pressure, like high blood pressure, because the body is holding on to all that fluids. So the blood pressure is going to be very high. It's hard to control the blood pressure. You may have issues with dieting. You The blood sugar, high blood sugar levels. What I also want to say is you may wonder how we test the GFR, the glomerular filtrate rate. So in testing it, sometimes they'll give the patient, like they'll inject like a dye. It's called IXL, and they will now take like a blood sample to see how well the kidney filter that from the body. So this will help them to decide how well the kidney is functioning. Okay, so renal colic is generally caused by stones in the upper urinary tract, obstructing the flow of urine. Immediate medical treatment is needed when the stone or structure is A, in the uropelvic junction, B, in the urethral segment near the sacroiliac junction, C, in the uretrovesical junction, and D, in the urethra. So this one, the answer is A. This is definitely a emergency. So this is a emergency due to the obstruction. Okay, so there is definitely a blockage where the kidney meets the ureter, and I'm going to show you that on the next slide, causing the urine to back up into the kidney. Let's go to the next slide. So this is a nice 3D slide for you, so you can see where the ureter meets the kidney. All right, so if there's a stone right there at that junction, then urine will back up in the kidney. Okay, and then that will cause a swelling. So the buildup of urine and swelling is called hydronephrosis in the kidney. If left untreated, eventually it can lead to kidney damage. All right. Also, I wanted to let you know too that stones that usually get stuck are stones that are 5 millimeters or higher in size. Okay. So next question: kidney biopsy has been scheduled for a patient with a history of acute renal failure. The patient asks the nurse, "Why do I need a biopsy?" How should the nurse reply? Now, in the hospital setting, you're always gonna hear of this test. A kidney biopsy, liver biopsy, there's all different types of biopsy. So A, biopsy is routinely ordered for all patients with renal disorder. B, biopsy is generally ordered following abnormal X-ray findings of the renal pelvis. C, biopsy is often ordered for patients before they have a kidney transplant. And D, biopsy is something necessary for diagnosing and evaluating the extent of suspected kidney problems. And the answer is D. Biopsy is generally necessary for diagnosing and evaluating the extent of suspected kidney problem. Okay, so listen to this keenly. A biopsy is done to remove tissue or cells from the body to examine under a microscope. Okay, the tissue sample is removed with a needle to check for example cancer, abnormal cells. It also helps to check how well the kidney is working. So that's why the answer is to evaluate. Okay, the nurse really need to check for stuff after you receive a patient back on the unit that recently had a kidney biopsy. We are looking for bruising and discomfort. Okay, the patient may complain of discomfort at the biopsy site, ongoing bleeding from the biopsy site in the urine, or inside the body. So we are really watching the patient for hemorrhage. Remember, signs of hemorrhage is sudden or intense pain. So we are always monitoring the patient's pain level. We are checking their vitals to make sure that their hemodynamics stable. So we're checking their blood pressure because remember that hemorrhage causes the blood pressure to drop low along with rapid pulse or heart rate. Okay. Okay, let's go to the next slide. Patients admitted for suspected renal dysfunction. When reviewing laboratory results for this patient, the nurse interprets the presence of which substance in the urine as most suggestive for of pathology. 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 A. Potassium and sodium. B. Bicarbonate and urea. C. Glucose and protein. And D. Creatine and chloride. So the answer is glucose and protein. So protein in the urine is called proteinuria. Okay, just let you know that. Normally, urine contains very little or no glucose. But if you have too much glucose in your blood, your kidneys will get rid of some of the extra glucose through your urine. So high level of urine glucose may mean that your blood glucose is high, or too high, and that could be a sign of diabetes. Okay, protein isn't normally present in the urine, and so this is usually a sign that the kidneys are not functioning the way they should. They're not functioning properly. It can be a temporary rise due to uh, dehydration, strenuous exercise, fever, exposure to extreme cold. These are things that can throw that throw that off a bit. So further evaluation will be needed. All right. We're definitely gonna need further evaluation for this situation. Okay, so next question. The nurse monitor a patient admitted with suspected renal dysfunction. Calculate that the patient weight has increased by 5 pounds since admitted yesterday. The nurse estimate that the patient has retained approximately how much fluids. Okay, so in order to calculate this, we would have to know some numbers here. Okay, so first thing we need to know is 1000 ml is equal to 1 gram. Okay, and the next we need to know is that 2.5 kilogram is equal to, when we're trying to convert from pound to kilogram, we're dividing by 2.5. So we'll have to divide the 5 pounds divided by 2.5 kilogram, and that will give you 2.27 pounds. Okay, and then now we're gonna times that by the 1000 ml, and that will give us the answer. But I see here the answer is B, 2300 ml, which that means that they round it, so they round up. So that's the answer. The answer is B. All right. So this is common. Weight gain is common in patients with kidney disease, because remember, the kidney is not filtering the blood. We are holding, the patient is retaining all these fluids. So there's a lot of retention going on. So you may see they do diuresis therapy for these patients if they're still if they're not in stage 5, because stage 5 they will not be producing any urine. Most patients, they don't produce any urine at all, so that won't work for them. So definitely that will have to be that they're going to dialysis therapy. Okay, so sometimes patient, well, most times it's a 3-day schedule. It's like a Monday, Wednesday, Friday, something like that, or Thursday, Tuesday, Thursday, Saturday. So they'll go 3 times per week. Sometimes when they're starting the dialysis for the first time, they'll do like 2 days in a row. All right, so that's it. Let's go to the next slide. We on to the next slide. A patient with renal failure secondary to diabetic nephropathy has been admitted to the medical unit. What is the most life-threatening effect of renal failure for which nurse should monitor the patient? A. Accumulation of wastes. B. Retention of potassium. C. Depletion of calcium. And D. Lack of blood pressure control. I'll give you a second to answer. And the answer is B, retention of potassium. Okay. If you're not urinating and you're retaining urine, fluid buildup in the body, which causes edema, swelling, shortness of breath. You may hear the term no P, no K. Potassium retention is the most life threatening effect of renal failure, which can lead to cardiac arrest. Now, I've had patients before that literally had have cardiac arrest while getting dialysis. Okay, patients missing their dialysis therapy, they are more prone to cardiac arrest. You will see it out there in the health field. So potassium, this is a very important electrolyte. Doctors are always monitoring patients that come into the hospital with kidney disease. They're always monitoring their phosphorus level and their potassium level. These are crucial electrolytes to pay attention to. Okay, no P, no K. Let's go to the next slide. Okay, so on this slide, I include some labs that you need to know where the renal function is concerned. So normal renal function values, I have the blood urea nitrogen, which is also called the BUN or the BUN, and the normal for that one is 10 to 20. Serum creatine for male is zero point 0.6 to 1.2, female 0.5 to 1.1. The bun slash creatine ratio is 6 to 25. Over on this side, creatinine levels reflects the glomerular filtration rate. Kidney disease is the only pathological condition that increases the serum creatine level, so it is very specific, okay? Serum creatine increases when 50% of renal function is lost. As I read this one, I remember a test that I took about this 50%. So the where it said the serum creatinine increases only when 50% of the renal function is lost, that is very important to know. Just a little hint. So here on this slide, I include the normal urinalysis values. You can see from hemoglobin to bacteria, bilirubin, it should be negative. Here again, I include a protein, it should be negative. Ketones, negative, but we know ketones can increase based on fasting. Glucose, negative. Specific gravity, 1.005 to 1.030. And we're going to talk some more about specific gravity. Okay, the color should be amber yellow. Okay, culture of organism should be negative. Okay. So I wanted to talk a little bit about specific gravity. So specific gravity measures the concentration of particles in the urine, the density of urine compared to water. Again, the value for that is 1.005 to 1.030. Increased urine specific gravity, when it's increased, okay, it's more, the urine is more concentrated. So you will definitely see that with the urine. It's yellow, very very dark, like dark yellow. It's not amber anymore, it's like deep. Maybe due to conditions such as glucose in the urine, heart failure, high sodium level in the blood, loss of body fluids, so the patient may be dehydrated. That's the first thing I would think about though when I see a dark urine, the dehydration, right? Narrowing of the kidney artery or renal artery, stenosis, shock. So if the patient goes into shock, we know they're not producing much urine anymore. SIADH, which is syndrome of inappropriate ADH secretion. Okay, so the next one, if it's decreased now, decreased urine specific gravity, this means less concentrated. So if you're drinking a lot of water and it's like the urine, like you can barely see a yellow, you know that, right? You know that it's decreased. So maybe due to damage to kidney, tubule cells can cause it. Diabetes insipidus, drinking too much fluids. So if you have a normal function kidney and you're drinking a lot of water, you know that your urine is not going to be amber yellow, right? So drinking too much water, kidney failure, low sodium level in the blood, severe kidney infection, which is called pyelonephritis, that can cause a decreased urine specific gravity. Okay, so those are reasons for having the increase or the decrease. Let's do another question. The nurse is caring for a patient who has a fluid volume deficit. When evaluating this patient urinalysis results, what should the nurse anticipate? A. Fluctuating urine specific gravity. B. Fixed urine specific gravity. C. decrease urine specific gravity, and D, decrease urine specific gravity. Let's give you a chance to answer. We just spoke about that. So the answer is D, an increase urine specific gravity. Okay. Urine specific gravity depends largely on hydration status. A decrease in fluid intake would lead an increase would lead to an increase in the urine specific gravity. With high fluid intake, specific gravity decreases. In patients with kidney disease, urine specific gravity does not vary with fluid intake, and patients' urine is said to be fixed specific gravity. Okay. Okay, so the loss of water, okay, or of fluids will cause the kidneys to conserve or retain water, therefore rising the specific gravity of the urine. So increase osmolality and creatinine concentration and causing darkening of the urine color. So the urine color will be dark in this case. Okay, let's go to the next slide. Okay, so on this slide, it's about chronic kidney disease and some facts. So kidney disease is the leading cause of death in the United States. Anemia or low red blood cells, those or comorbidities that is prone in patients with kidney disease. Okay, increased occurrence of infection, low calcium levels, high potassium levels, and high phosphorus levels in the blood. I told you that before, right? So silvalimar is a is bicarbonate. Silvalimar bicarbonate. That's a pill that you'll see patients that's on dialysis get a lot in the hospital with meals, and even they'll take it at home. And this helps to control high blood levels of phosphorus in people with chronic kidney disease or on dialysis. So this pill, get familiar with it. You're gonna see it whether you're in clinical or when you begin as a new nurse. Okay. Risk factors include diabetes, high blood pressure, heart disease, family history of chronic kidney disease, and obesity. Okay, so yay, 100%. You're at 100%. You passed. So, on this slide, I just want to remind you to educate your patients whenever you start practicing. And these are some things that you may want to tell them. Keep blood pressure below 140 over 90, or at the target their doctor or physician established for them, right? If diagnosed with diabetes, stay in your target blood sugar range as much as possible. Get active. Physical activity helps control blood pressure and blood sugar levels. Lose weight if you're overweight. Educate patients to take blood pressure medication as prescribed by their physician. All right. If you found this video helpful, remember to like, subscribe, and share the video. Subscribe to Ship It All Registered Nursing. Bye. Remember to shine. You're a star. And thank you so much for watching. Thank you for your support.